The year was 1918, a time when the world was embroiled in one of the most devastating conflicts in human history, World War I. The war had already claimed millions of lives and left countless others scarred, both physically and emotionally. The world was at war, consumed by conflict and bloodshed. Soldiers fought in the trenches, enduring unimaginable hardships, while civilians back home faced shortages and uncertainty. Yet, amidst this chaos, a silent killer emerged, one that would claim more lives than the battlefield themselves. This unseen enemy was the Spanish flu, a pandemic that would sweep across the globe with a ferocity never before witnessed. This was the Spanish flu, a pandemic of unprecedented scale and ferocity. It struck swiftly and without warning, leaving communities reeling in its wake. People were advised to wear masks and public gatherings were banned in an attempt to curb the spread. It swept across the globe with terrifying speed, leaving devastation in its wake. Entire cities were brought to a standstill, their streets eerily empty as people stayed indoors, fearing the invisible threat that lurked outside. Imagine a world where cities become ghost towns, streets eerily empty, businesses shuttered, schools closed, and the once bustling public spaces fell silent. The sense of isolation was palpable as people were forced to distance themselves from one another to stay safe. Picture hospitals overflowing, their corridors filled with the sick and dying. Medical staff, already stretched thin by the war, struggled to cope with the influx of patients. Makeshift hospitals were set up in public spaces to accommodate the growing number of victims. This was the grim reality of 1918. The Spanish flu did not discriminate, striking down young and old, rich and poor alike. It was a time of fear and uncertainty as the world grappled with an enemy it could not see. The Spanish flu did not discriminate, striking down young and old, rich and poor alike. It affected every corner of society, from the crowded urban centers to the most remote rural areas. No one was safe from its reach. From the crowded trenches of the Western Front to remote villages in the farthest corners of the globe, the virus spread relentlessly. Soldiers, already weakened by the harsh conditions of war, were particularly vulnerable, and the flu spread rapidly through the ranks. It infiltrated every level of society, halting daily life and leaving a trail of unimaginable suffering. Markets were empty, shops closed, and the usual hustle and bustle of daily life came to a grinding halt. The world had never seen anything like it before, and the experience left an indelible mark on human history. The Spanish flu pandemic of 1918 serves as a stark reminder of the vulnerability of even the most advanced civilizations to the invisible power of disease. The 1918 pandemic serves as a stark reminder of the vulnerability of even the most advanced civilizations to the invisible power of disease. It is a story of loss, resilience, and the enduring human spirit in the face of unimaginable adversity. It is a story of loss, resilience, and the enduring human spirit in the face of unimaginable adversity. The lessons learned from this dark chapter in history continue to resonate today, reminding us of the importance of preparedness, solidarity, and compassion in the face of global challenges. The exact origins of the 1918 influenza pandemic remain a mystery, shrouded in the mists of time. Despite extensive research and numerous theories, scientists have yet to pinpoint the precise location or the initial host that triggered this catastrophic event. However, the first recorded case emerged in Haskell County, Kansas, in the early spring of 1918. This small, rural community became the unlikely starting point for a virus that would soon engulf the entire world. From this rural American county, the virus embarked on its deadly journey, spreading rapidly through troop movements and civilian travel. The interconnectedness of the world, even in the early 20th century, played a crucial role in the virus's swift dissemination. The world was at war, and the movement of soldiers across continents provided fertile ground for the virus to spread. As soldiers moved from one battlefield to another, they carried the virus with them, unknowingly acting as vectors for this deadly pathogen. Soldiers, crammed into crowded barracks and trenches, became unwitting carriers, transporting the disease to new territories. The close quarters and unsanitary conditions of military life created a perfect breeding ground for the flu to thrive and mutate. As troops returned home from the battlefields of Europe, they carried the virus with them, unknowingly infecting their loved ones and communities. The joyous homecomings were soon overshadowed by the rapid spread of illness and death. The flu traveled by ship, by train, and by foot, silently infiltrating cities and towns across the globe. The modes of transportation that connected the world also facilitated the virus's relentless march. Within months, it had reached every corner of the world, from the bustling metropolises of Europe and North America to the remote villages of Asia and Africa. No place was too isolated, no community too remote to escape its deadly grip. No country was spared from its reach. The pandemic's global spread was a stark reminder of our interconnectedness and the vulnerabilities that come with it. The 1918 influenza pandemic left an indelible mark on human history, reshaping societies and altering the course of the 20th century. The 1918 influenza was unlike any flu the world had seen before. It struck with a swiftness and ferocity that left doctors baffled and terrified. Healthy individuals could wake up feeling fine, only to succumb to the illness within hours. The virus attacked the respiratory system with brutal efficiency, leaving its victims gasping for air. Symptoms often began with a high fever, chills, and muscle aches. These were quickly followed by a debilitating cough, sore throat, and headache. In severe cases, the flu progressed to pneumonia, filling the lungs with fluid and making it nearly impossible to breathe. What made this flu so terrifying was its ability to kill young, healthy adults. Unlike typical flu strains that primarily affect the very young and the elderly, the 1918 pandemic claimed the lives of millions in the prime of their lives. This unusual characteristic left families shattered and communities reeling. Section 4. A desperate fight. Early attempts to contain the unseen enemy. In 1918, the world was ill-equipped to deal with a pandemic of this magnitude. Medical science was still in its infancy and antibiotics were yet to be discovered. Doctors were fighting a losing battle against an invisible enemy they barely understood. Faced with mounting casualties, health officials resorted to desperate measures. Quarantine measures were implemented, schools and businesses were shuttered, and public gatherings were banned. People were urged to wear masks, and public health campaigns promoted hygiene practices. However, these measures often proved ineffective. The virus spread too quickly, and the world was too interconnected. Hospitals were overwhelmed, running out of beds, medical supplies, and even doctors and nurses. The healthcare system, already strained by the war effort, was pushed to its breaking point. Section 5. A world on pause. The flu's impact on society and economies. The 1918 influenza pandemic brought the world to a standstill. Schools, factories, businesses, and government offices all shut down in an attempt to slow the spread of the virus. Cities and towns became eerily quiet, their streets deserted except for the sick and dying being transported to overwhelmed hospitals. The pandemic had a devastating impact on the global economy. Production plummeted, trade ground to a halt, and unemployment soared. The war-torn world, already struggling to rebuild, was dealt another devastating blow. Beyond the immediate health crisis, the pandemic had a profound social and psychological impact. The loss of life was so widespread that it left entire communities reeling. Fear and uncertainty gripped the world, leading to social isolation, xenophobia, and a pervasive sense of grief and despair. Section 6. Echoes of the past. The Spanish flu in the shadow of other pandemics. The 1918 influenza pandemic was not the first pandemic to ravage humanity, nor would it be the last. It emerged in the final year of World War I, a time when the world was already reeling from unprecedented loss and suffering. The Spanish flu spread rapidly, facilitated by the movement of troops and the close quarters in which they lived and fought. It infected 1/3 of the global population and claimed the lives of an estimated 50 million people, making it one of the deadliest pandemics in human history. Throughout history, infectious diseases have repeatedly emerged, leaving their mark on civilizations and shaping the course of human events. These pandemics have not only caused immense human suffering, but have also led to significant social, economic, and political changes. They have influenced the rise and fall of empires, altered trade routes, and even spurred advancements in medical science and public health. From the Black Death in the 14th century, which wiped out 1/3 of Europe's population, to the devastating outbreaks of the Justinian plague in the 6th century, Pandemics have been a recurring nightmare. The Black Death, in particular, had profound effects on European society, leading to labor shortages, economic upheaval, and changes in social structures. To the recurring outbreaks of cholera and smallpox, which plagued communities for centuries. Cholera, often linked to poor sanitation and contaminated water, caused numerous pandemics in the 19th and early 20th centuries. Smallpox, on the other hand, was a constant threat until the development of a successful vaccine led to its eventual eradication in 1980. Pandemics have been a constant threat to human health and survival. They have forced societies to adapt, leading to the establishment of quarantine measures, the development of vaccines, and the creation of public health institutions. Each pandemic has taught valuable lessons, highlighting the importance of preparedness and the need for a coordinated global response. The Spanish flu, however, stands out for its sheer scale and virulence. Unlike many other pandemics, it affected young, healthy adults disproportionately, leading to a high mortality rate among this demographic. Its rapid spread and high fatality rate overwhelmed healthcare systems and led to widespread panic and social disruption. More recently, the world has faced outbreaks of SARS, MERS, and Ebola, each posing significant challenges to global health. These outbreaks, while serious, were contained through swift public health interventions and international cooperation. They served as critical reminders of the need for vigilance and the importance of robust healthcare systems, and of course, the COVID-19 pandemic. The COVID-19 pandemic has been a stark reminder of our vulnerability to infectious diseases. It has disrupted lives, economies, and societies on a global scale, leading to unprecedented public health measures and a race to develop effective vaccines and treatments. While these outbreaks have been serious, none have reached the global devastation of the 1918 influenza. The Spanish flu's impact was so profound that it has become a benchmark for understanding the potential consequences of future pandemics. It underscores the importance of learning from past experiences to better prepare for future threats. Yet they serve as stark reminders of the ever-present threat of infectious diseases and the importance of global cooperation and preparedness. As we move forward, it is crucial to invest in public health infrastructure, support scientific research, and foster international collaboration to mitigate the impact of future pandemics and protect global health.